Hello, my name is Victoria Sharp, and I am a student physical therapist at Campbell University. Today I will demonstrate lumbar mobilization with physiological forward bending. Lumbar mobilization with physiologic forward bending is a manual therapy technique utilized by physical therapists to restore function. It is indicated when restrictions in physiologic segmental forward bending or a restriction in facet joint opening is noted. This technique has been shown in the evidence to reduce pain and restore range of motion due to joint stiffness and/or limited range of motion secondary to pain. Here we have a model of the spine. The spine consists of 33 individual vertebrae running along here, 25 of which are movable segments. For this manual therapy technique, we will be focusing on the lumbar vertebra, which range from here to here. A key structure within the spine that dictates the direction and amount of spinal movement that occurs is the facet joint. You can see them right here. These are commonly referred to as the interzygoapophyseal or zygoapophyseal joint. Due to the orientation of the facet joints of the lumbar spine within the sagittal plane, the lumbar spine has the greatest amount of motion and flexion and extension, followed by side bending in the frontal plane and the least amount of motion with rotation in the transverse plane. Normal motion of the lumbar spine allows for 40 to 60 degrees of flexion. During forward bending, the superior vertebra rotates and glides anteriorly, opening the intervertebral foramen and is checked by the posterior ligamentous structures. It is this movement that this mobilization technique facilitates. With lumbar mobilization with physiologic forward bending, the physical therapist performs a sustained passive segmental glide of the involved joint at the spinous or transverse process, while the patient moves actively into flexion. There are two methods for hand placement for this technique, which I will show you on the spine model right now. One is thumb over thumb, like so, and the other is using the hypothenar eminence, which is located underneath my pinky, or the pisiform. So it looks something like this. So with this, you want to ensure that your forearm is in line with the direction of the force to be applied. Now I'm going to perform the lumbar mobilization with forward bending. So before you begin, you want to ensure that your patient is seated with their feet on a stool and that you have a stabilizing belt that is securing their pelvis. So what you want to do is wrap the belt around your patient on the anterior portion of the iliac crest, and then you want to secure the belt to you with a quick release, just in case you have to during the mobilization. So to begin, you can use your preferred hand placement. I'm going to do thumb over thumb. Locate the level that was causing the problems with the opening restriction. Apply a superior anterior glide to the spinous process, and then request that your patient bend forward. So Marissa, will you bend forward? Make sure that you sustain the passive mobilization through the entire duration. Come back up. And that's the lumbar mobilization. So Marissa, the technique that we just performed is what's called lumbar mobilization with physiological forward bending. So what that technique helps you with is that since you have trouble with bending forward or flexing your spine, that helps facilitate the movement in your spine in order to let you perform that movement. So this will hopefully decrease your range of motion restrictions and also decrease your pain. A study published in 2015 in the Journal of Manipulative and Physiological Therapeutics found that lumbar mobilizations with movement, or lumbar snags, showed improved short-term effects on range of motion, pain with trunk function, and function in patients with nonspecific low back pain. No statistically significant improvements were noted in the speed in which these patients performed trunk flexion post-snag application. This lends insight into the significance and benefits of this mobilization technique within physical therapy practice concerning this particular patient population. This intervention can be administered to achieve patient's goals. Another study in the Journal of Manipulative and Physiologic Therapeutics in 2007 investigated the immediate effects of flexion mobilization with movement in 26 subjects with low back pain who showed deficits in flexion range of motion and who experienced pain when performing lumbar flexion. They found that mobilizing patient spine segments using 2 to 3 sets of 4 to 6 repetitions for 3 minutes yielded a greater than 7-degree increase in true and total lumbar flexion in those patients with low back pain compared to the placebo group. However, no improvement in pain reduction was found. This provides therapists with the standard frequency and duration of technique application to see an improvement in lumbar range of motion among patients with low back pain. Another study investigating the immediate effects of lumbar posterior-anterior mobilizations at different rates on pressure pain threshold and extent on hypoaglesia on asymptomatic patients revealed that mobilizations performed between 0 and 2 Hz showed significant improvement in pressure pain threshold measures. 5 sites ranging with the low back to the distal portion of the upper extremities were tested for pressure pain threshold. These findings indicated that hypoaglesia was both local and widespread in these asymptomatic patients. These findings suggest that if this technique were applied to symptomatic patients, potentially a similar, if not greater, response would occur.